All right. Good afternoon. Another afternoon of learning about supplements and discussing how they could be beneficial and what are the risks, particularly in context of cancer with Dr. Donald Abrams. So this afternoon, I've got Tammy Ballard with us, along with Dr. Abrams, and we are talking medicinal mushrooms today. So let's go ahead and kick this off. Tammy?
Thank you, Sumit, and Dr. Abrams, thank you so much for joining us today. Starting at the top, what exactly are medicinal mushrooms?
So mushrooms are a fabulous organism. They're not plants and they're not animals. They're actually closer to animals than plants, to be honest. And in Asia, a society that's much more fungophilic, if you will, loving of mushrooms, compared to us in the West, where we're more phobic or fungophobic, fearful of mushrooms. Mushrooms have been used for centuries as part of therapeutic armamentarium. The mushroom that we see is the so-called fruiting body, but it develops from an underground network of single cell strands called the mycelia. And those mycelia lead to the fruiting body, the recognizable mushroom. There are many potential sources of medicines from mushrooms, the mycelia, the fruiting body, and the spore. But the way the mushrooms work in the body is that the cell wall of the mushroom resembles the cell wall of a bacterium. So when we ingest a medicinal mushroom, our body thinks we're being invaded by a bacteria, and it mounts a non-specific immune response that hopefully will also knock out any cancer. In Asia, again, particularly Japan and China, mushrooms are very frequently used in conjunction with both chemotherapy and radiation therapy. And the value is that they seem to augment the benefit of the chemo and the radiation in the fight against the cancer. And most of the research supporting mushrooms does come from the East, which is a problem because we in the West are very centered on research that we produce here. In fact, I just had lunch with an oncology colleague who said to me, how do we know those mushrooms you recommend that our patients take actually work? And I said, well, there's a great body of research. I was one of the editors of the National Cancer Institute Physician Data Query Integrative and Alternative Complementary Therapies website. So NCI PDQ mushroom, and you'll get a lot of information that we've collected on the use of mushrooms in cancer therapies. Most of it, again, done in Asia.
Thank you. I actually received this question quite a bit from young women with breast cancer. What types of these mushrooms, medicinal mushrooms, do you recommend? And, sort of what differentiates mushrooms, and how should a patient undergoing treatment for cancer, how do they learn about these mushrooms? And, where can they purchase these mushrooms?
Yeah. So again, the mushroom that's been studied the most in Asia is Trametes versicolor, used to be known as Coriolis versicolor, and the simple name is turkey tail. Turkey tail is a mushroom that grows on a tree stump or logs, and it's fuzzy and very thin and not a mushroom that you're going to eat. So turkey tail is produced by a number of manufacturers and comes available as capsules, as tinctures, or as powders for people that use smoothies. And turkey tail has been studied predominantly a polysaccharide fraction of turkey tail in Japan called PSK has been studied a lot in cancer, as well as PSP, which is a similar polysaccharide studied mainly in China. Personally, I prefer the whole mushroom, so I tell patients to get turkey tail. And again, turkey tail is one that's working via immune enhancement. So patients who have an enhanced immune system already, those who have lymphoma, chronic lymphocytic leukemia, or multiple myeloma, I often don't recommend that they take medicinal mushrooms because I feel their immune system is already hyperactive. Similarly, people that are being treated with the new immunotherapies, I caution maybe you don't want to take the medicinal mushroom because you don't want that medicinal mushroom's immune enhancement to interfere with the very potentially therapeutic immune enhancement of our current immunotherapies. These are two things that are just based on my Gestalt feelings, not on any research, because no research has been done on this topic. But turkey tail being my favorite anti-cancer mushroom, Christopher Hobbs is a mycologist who wrote an excellent book on medicinal mushrooms. And he agrees with something that I learned many years ago from a traditional Chinese medicine practitioner. The body doesn't like to see the same mushroom every day. So I tell my patients, get turkey tail. And I often recommend a 7 mushroom blend that doesn't include turkey tail. And I say, take turkey tail for 4 to 6 weeks, because that gives you the potential maximum benefit. And then switch to another mushroom, or perhaps to that 7 mushroom blend that I think has 7 other mushrooms that may be immune enhancing, but don't include turkey tail. And take that other mushroom for 4 to 6 weeks, and then go back to the turkey tail and keep going back and forth. One of the mushrooms in that 7 mushroom blend is reishi, or Ganoderma lucidum, known as the mushroom of immortality in China. And this is probably one of the most widely sold mushrooms worldwide. Again, it grows on a tree trunk, and it's shellacky, and it can't be eaten. Many of my Chinese patients get it in Chinatown and make a tea. I don't think a tea is quite as potent as taking capsules of reishi or turkey tail. So reishi is a good mushroom, and they have studied that some of the other components in reishi seem to have direct anti-cancer activity against some types of cancer cells in the test tube. The first evidence really that mushrooms may have some benefit against cancer came from Japan, where the farmers that grow enoki-taki mushrooms, those thin, white, filamentous ones that are often in miso soup, those farmers tend to have lower rates of cancer than farmers in the neighboring prefecture. So that led people to look at those enoki mushrooms and find that they do have immune enhancing and perhaps some anti-cancer activity. So there are some good edible mushrooms. Those would include shiitake and maitake and the enoki or enoki-take. The white button mushroom, the most famous mushroom in this country, belongs to the species called agaricus. And all mushrooms must be cooked. White button mushrooms actually have a cancer-causing compound in them. So all mushrooms must be cooked. White buttons, their brown cousins, the crimini, and their giant cousin, the portobello, may have some aromatase inhibitor. So good for women with breast cancer, but all mushrooms must be cooked.
Wow.
Other mushrooms that I think I often recommend to my patient are lion's mane, which is also an edible mushroom. It looks like a snowball. It's a big white furry thing, and it's actually quite delicious when it's cooked up appropriately. But again, for its medicinal benefit, I think it's better to take in a capsule form. Lion's mane is getting a lot of press currently because it may enhance brain-derived nerve growth factor. So it's a mushroom that I particularly recommend to patients who may have nerve damage from their chemotherapy, or for patients who complain of chemo brain, because it may help with that as well. Another mushroom that I'm particularly fond of is actually a fungus that parasitizes a caterpillar, originally found in the Tibetan highlands, and it's called Cordyceps. And it's an oxygenating mushroom, so it energizes. The 1980 Chinese women's relay team broke all sorts of land speed records, and when they got tested for doping, the only thing that they were actually using was Cordyceps sinensis, the mushroom. And so it's one of my go-to mushrooms that I recommend to patients suffering from fatigue. It's also perhaps something that might enhance libido, and particularly male vitality. So that's something I'm often discussing with patients as well.
Those people who are, sensitive to cancer prevention, and just overall a holistic approach to their health? Are there benefits of other types of mushroom?
Yeah, again, I know many of my older friends, and I can count myself amongst them, are very interested in lion's mane or hericium for its mental clarity effects, and cordyceps for energy. And some people like to take the turkey tail and reishi, even if they don't have cancer, just because they're felt to have some potential therapeutic benefit.
What are the risks? You sort of mentioned some of them throughout, the talk, but are there other sort of things that, people with cancer or people taking or interested in mushrooms for, preventative reasons should be aware of or be sensitive to?
Yeah, I generally find that the mushrooms that I recommend are very well tolerated. Again, they're capsules usually. Today I saw a woman who said, well, I stopped taking the turkey tail because I think it upset my stomach. And I think stomach upset or nausea might be one of the main concerns that I have. Again, however, my oncology colleague that I ate lunch with is one of my colleagues who tells all of her patients, stop taking Donald's darn mushrooms when you're getting chemo because I don't know if they're going to interact. And so my point to her today was, in Asia, these are used in conjunction with chemo and radiation, and they seem to potentiate the benefit. So don't tell my patients that I told them to take mushrooms to stop. But, people are very phobic about the liver. And when I see a cancer patient getting chemotherapy and their liver blood tests are elevated, their oncologist always says, stop the mushrooms. Well, guess what? Chemotherapy probably did that, not the mushrooms. But I think, mushrooms can tickle the liver a little bit. So it is something to be careful of. And then the whole question of, is there a potential pharmacokinetic interaction between the mushrooms and the cancer drugs that the patient is taking, be it chemotherapy, immunotherapy, targeted therapies or hormonal therapies? We don't know because those studies have really not been done. What we know is the data generated in Asia that people taking mushrooms in conjunction with chemo, for example, seem to do better than those who don't.
Thank you, Dr. Abrams. This was certainly a great learning session this afternoon on mushrooms. If you would like to learn more about mushrooms, come take a look at wellkasa.com, where not only will you find this video, but in addition, you will have access to research that Dr. Abrams talked about. You will also have access to curated high-quality mushroom products, as well as wellness plans that incorporate mushrooms that are designed by Dr. Abrams. So until next time, wish you good health.